The heart of this industry are the caregivers that are providing care to the patients. If you don't have the relationships with those providers to ensure that you're providing value to them, then you're not going to have a solution that they're going to adopt. My name is Jason Burke. I am the Vice President of Revenue Cycle and Revenue Integrity here at Solventum. My job, I love it because every day I get to work with customers, with hospital systems, with healthcare providers to improve their lives, to make their jobs easier. We provide software and services to the healthcare market to be able to ensure that their coding for their reimbursement is done accurately and properly and within the compliance standards that are regulated in the industry. One of the biggest challenges that hospitals have today in physician practices is that they're constantly being pressured to reduce their cost of care. And the compliance rules and regulations continue to change and get more aggressive. So it's hard for a human or a person to be able to maintain all of that knowledge and expertise. So AI is transforming healthcare. It's transforming the world, as we all know. When you look at all of the different thousands of tools that are out in the market, the critical piece is the integration between software and the electronic health record, and to ensure that it works correctly. So we work with all EHRs, electronic health record companies, to ensure that the data exchange between our products and their products and how those products function work well. And that drives productivity gains. It drives more accuracy and better results as the customers use the products. We probably are one of the top 2 or 3 companies in the US that have access to the amount of data that we have. And that allows us to train the models more efficiently and effectively across the healthcare continuum that we look at. We traditionally get the full medical record about that patient's stay. We get the financial information, charge information, historical denials to allow us to build those models to be able to provide this kind of feedback and advice back to the user or the physician. Jobs are going to change in healthcare, especially in revenue cycle and HIM. Their jobs will become more important, to be honest. We are fully committed to ensure that we elevate them in the organization, and we'll do that through training. Our intent is to get everybody working and focused on the things that automation cannot handle, which are typically the most complex things that an organization needs people for. I love what I do. I love healthcare. And I would say most importantly, I love our clients. Our clients, they teach us every day. And that drives, excitement and value that we learn from to make sure that we're delivering what we need to make them happy and get results.